everyone, and welcome to the Babies in Common Show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. As a reminder, any information shared during the show is not to be taken as medical advice. Please consult your own care providers for questions about you and your baby's health, and visit babiesincommon.com/disclaimer for more information.
Awesome. So today is September 22nd, 2020, and we'll be discussing birth trauma and filing a complaint. Just as much as sending a letter of thanks to care providers is a good thing to do after you have a good birth experience where you feel like you were treated with respect, sometimes we need to send a letter to complain about how we were treated. And additionally, the process of filing a complaint may even offer you some healing. And we have our friend Rebecca Zanconato here today, and she's going to talk with you about her experience as well as how to file a complaint. So welcome, Rebecca.
Thank you. Thanks for having me.
Awesome. So I'll allow you to introduce yourself after I give you a little bit of background information about this topic. So not give you, but our listeners. So according to Penny Simkin, who's a world famous author and childbirth educator, as well as a doula and a doula trainer, and she's also the founder of Prevention and Treatment of Traumatic Childbirth, which is an organization, the abbreviation is PATCH, P-A-T-T-C-H. And she says that between 25 and 34% of women report that their births were traumatic, which is really high.
A quarter to a third. I mean, That's a pretty staggering statistic.
That's a lot. Yeah. And a birth is said to be traumatic when the individual, the mother, father, or other witness, believes the mother or her baby's life was in danger, or that a serious threat to the mother or her baby's physical or emotional integrity existed. And following the birth, some of these people go on to develop post-traumatic stress disorder, PTSD, which is a severe and long-lasting reaction to the trauma. And there's specific criteria for diagnosing PTSD, which can be found in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. I think it's an expression, PTSD, that gets thrown around a lot when it's actually a diagnosable serious situation.
Yeah, people can have traumatic experience and symptoms of a traumatic response, but not go on to develop post-traumatic stress disorder.
Right, yeah. If they do have it, though, symptoms would include nightmares, flashbacks, avoiding the location or people associated with the trauma, detachment from others, difficulty sleeping, angry outbursts, panic attacks, and significant distress in social, occupational, or other areas of functioning. So that's something you can look into if you think you might have PTSD. So, yeah.
And the more that I've learned about PTSD surrounding trauma during childbirth, more is coming out that helps people understand it's not just going through something hard, and it's not even going through something scary, because people can go through something hard or scary and not develop a traumatic response. When our brain develops a traumatic response to a traumatic experience, it's almost as if the brain walls off that experience and doesn't integrate that memory like it would every other memory that kind of fades over time. And the person will re-experience that traumatic event, the sights, the sounds, the smells, as if it was happening right now in the present moment. So that's what we say when we mean things like flashbacks. The person can have a trigger and relive the trauma of that experience as if it was happening to them in this moment. Most women who have had a traumatic birth don't go on to develop PTSD. Studies report rates of PTSD after childbirth as varying between 1.5 and 9% of all births. The differences among study findings are partially explained by differences in study designs, assessment tools, populations, and usual maternity care practices and caregiver attitudes. But those who have had traumatic births but are not diagnosed with PTSD have fewer symptoms of the disorder or a duration of symptoms of less than a month. Recovery from this trauma occurs with time, support, and can be facilitated by empathetic discussion with a knowledgeable caregiver and various non-pharmacological treatments such as adequate sleep, exercise, support groups, bodywork, therapy, and self-help guides to trauma recovery. What's important for listeners to also understand is that there's a period of neuroplasticity that occurs after someone has experienced a traumatic event. And after childbirth, it's usually the 6 weeks after the event that if you can get help to process that trauma in a healthy way, it makes it much less likely that you'll develop actual diagnosable PTSD. So with that being said, I'd also like to just if it isn't already apparent to our listeners, that, just a trigger warning that this podcast is going to be talking about somebody's traumatic birth experience as part of learning how to file a complaint. So just be aware that there will be some information that might be upsetting to some people.
Good point. So many parents who've experienced birth trauma don't file complaints about how they were treated because they feel that when their trauma was related to how a care provider spoke to them or physically touched them, that's in the past. It's over with, move on, I've got a baby. They're just not ready to think about the trauma, and they can't even wrap their head around how to file a formal complaint. But today's guest will share why she chose to file a complaint, how the process works as well. So if you want to do the same, you'll know where to begin. So, all right, Rebecca, if you could introduce yourself and then tell us about your births, all 4 of them, and then we'll get into more details. So who are you?
Okay. So my name is Rebecca. I am an anesthesiologist. I have worked at a couple of different hospitals. I do adult and pediatric anesthesiology, and I now, at my current job, do obstetric anesthesia as well. So I have been on the opposite end as far as the anesthesia part, in addition to receiving obstetric anesthesia.
Yeah, so you're a doctor, you're an anesthesiologist, and so I always loved this part of the story too. So with your first baby, did you hope to have an epidural?
I wanted to avoid an epidural.
And you wrote a whole blog about your whole experience on our website on babiesandcommon.com, which you can read all about, which is interesting.
Yeah, I'm not completely anti-epidural, but my thought with my first baby was that this is a natural, normal process that our bodies are meant to and capable of doing. So my plan was to not have an epidural. I think there is a role for them at times, but it's also an invasive procedure that does carry risks. And I think the anesthesiologist, I was acutely aware of the potential risks, so I wanted to do my best to avoid those.
Yeah. And your first baby, you needed one because you ended up needing a cesarean. So can you share what happened with that?
Sure. So I ended up being induced at the very end of my first pregnancy. Questionable whether it needed to really be done, but it was my first baby and I was trusting my obstetrician. Not surprisingly, a first-time mom, before 40 weeks, the induction wasn't progressing well. I ended up getting an epidural, and shortly after the epidural, the baby's heart rate dropped drastically. We ended up going to the operating room for a C-section. It turned out that the heart rate drop was because the epidural dropped my blood pressure significantly, which then very often drops the baby's heart rate. So it was actually a result of a complication of the epidural. A known complication, but unfortunately, no one really, I don't think, noticed it, so it didn't get treated in time to avoid the C-section.
And did you consider at the time your cesarean birth experience as a traumatic experience?
Look, I would. Yes, I would. The whole process, the induction that didn't feel right to me, how the induction is done, how people just do things without asking you or telling you why, and just say, this is what we're doing, and they do it. They don't even ask your permission or discuss it. And then you feel like things aren't going well, and no one's really talking to you about it. Not to mention, you're just hooked up to so many things. It's like, I joke around with people at work that, some inductions are like torture. You're up to a bunch of things are poking you, prodding you, it's uncomfortable. I was on bed rest, so you can't get up and move around. And then here are the labor contractions. So yeah, it was not a good experience. And then the C-section was a very disappointing end for me because, I know that major abdominal surgery carries possible post-op complications as well, something certainly I'd hoped to avoid. So afterwards, yeah, I definitely struggled with processing it. I didn't really get help for it because, as far as I knew, that was just how things go. And I didn't really know there was much I could do about it.
And there's something that you said, Rebecca, that I want to highlight for our listeners, because the most recent research surrounding traumatic birth experiences, some of the things we highlighted in the intro, as far as, many people, a risk factor for trauma is, for example, worrying that you or your baby's life is in danger. That certainly can predispose someone to having a traumatic event. But another thing that isn't something that people often think of, but has been shown through the research to be a risk factor, a major risk factor, is regardless of the outcome, it's not, vaginal birth or cesarean birth or emergent birth. One of the biggest risk factors is not feeling heard and listened to. And so it sounds like that was a part of your experience as well, being hooked up to monitors, being part of the machine, things happening to you without your consent or understanding, being left to labor in a bed through pain, not being given options, other than, it sounds like, an epidural. If they made you stay in bed, certainly, hard to labor in a bed without pain medication. So that's definitely, even if you didn't have an emergency birth or a cesarean birth, even if you had, quote, an unmedicated vaginal birth that you were hoping for, you could still have a traumatic birth experience if you did not feel heard and listened to.
Right. That idea that things are just being done to you and that you're not an active participant in the process, I think, is a huge part of it. Definitely a huge part of it for me, but also for many people who I speak to.
Yeah. So what about your second baby's birth? Many people are encouraged to just have a repeat cesarean. So, how did that birth happen and for you?
So I was told by my obstetrician I was a perfectly good candidate for a VBAC, which is what I wanted to do.
And that's vaginal birth after cesarean. Excellent.
So I don't even remember how, but I found out about Babies in Common somehow at the end of my pregnancy.
Yay!
I took Jeanette's natural childbirth class. We loved it.
Which at the time was a 16-hour class, people.
I
know, you're moving at Comfy's 5 hours, and people are like, that's a long class. I'm like,
you're like,
really?
No, it's
not. My husband loved it. He loved the class, so tells you how good the class was. So we did that. It inspired us to hire a doula, which was excellent, really helped us a lot. Also just to read more and learn more, and to keep learning more. So we really felt very well prepared going into this birth. As far as what happened with the birth, my water broke. I was one of those unfortunate people who didn't go into labor after that happened. Eventually, we all agreed it was time to start Pitocin because I was getting tired, quite frankly, and I felt like we need to do something here. I can only do this for so long. The induction was going overall well for a while, and then it got to the point where contractions had no breaks in between them. And at that point, I asked for an epidural because I couldn't handle no breaks in between. Got the epidural, baby's heart rate dropped again. This time was not related to blood pressure. It turned out I had dilated very quickly and the baby had descended very quickly. So it was resolved with some repositioning. But again, a possible complication of an epidural, which was why, again, I hoped to avoid it, but got to a point where I felt that that was what I needed to do. So baby was doing okay. Unfortunately, when it came time to push, the baby didn't seem to be moving much at all. So I was told I might need another C-section, which I really wanted to avoid. They said they could try a vacuum. I opted for that, sort of the lesser of two evils in my mind. They did the vacuum. Unfortunately, the obstetrician who was doing it did an episiotomy and then tore me more to kind of speed things up. Baby was not in distress. Everything was fine. And I had a vaginal birth, but then I ended up oozing so much from the 4th degree tear that I couldn't even sit up, never mind stand up. They offered me a blood transfusion. I didn't end up taking it, but I was definitely suffered significant blood loss.
Oh my gosh.
So that was not ideal. It turns out the reason the baby wasn't moving in the birth canal was his head was tilted slightly, which can also happen from a baby descending rapidly after an epidural. It could also have to do with my anatomy. There's no real way to know, but these things can happen. I think it's just unfortunate that, again, they did an episiotomy, no discussion or anything like that. So again, I think I felt like things were being done to me and that I didn't have any say or any control.
And the way you describe the Pitocin being administered is a very common way that Pitocin is administered, basically turning up the medicine to maybe an arbitrary number and not really assessing the contraction pattern. And although that's common, that's actually not an evidence-based responsible way to run Pitocin. You know, Pitocin is supposed to mimic natural labor. It's supposed to give you breaks in between, not only for the comfort and, you know, of the mother, of the birth giver, but also the baby needs at least, and that would be the minimum, 60 seconds of uterine rest in between contractions in order to get enough oxygen. And so it's, you know, a lot of people who need to be induced that are desiring an unmedicated birth are rightfully nervous that that desire of an unmedicated birth might be, you know, complicated by the induction. And I always like to remind them that it's not the Pitocin that's the problem. It's the way that it is administered. Because, you know, I have worked for hospitals where the nursing staff and provider staff are very, very conservative with Pitocin, and they only use it when absolutely necessary. And they turn it up, you know, only 1 milliunit per, milliliter per hour every 30 to 60 minutes, and they're really slow with it. And yes, I've had people have unmedicated, you know, births with Pitocin inductions when Pitocin is run responsibly. I've also seen many, many people, you know, basically have to cry uncle at some point when they're not getting a break, as you describe, and get an epidural because they can't cope. Who could cope? That, you know, that's not how normal labor would unfold. So I'm sorry to hear that that happened to you during your second. I mean, you got the quote VBAC that you wanted, right? So I'm sure there are people that were like, oh, well, that's what you wanted. You know, why are you upset? And as we've talked many, many times before on this podcast, that's a, you know, really unhelpful thing to say to somebody who just had a traumatic birth experience. But, you know, I'm holding my breath because I don't know your story, Rebecca, like Jeanette does, but was your third baby any better?
So this is the third baby. So the third baby, we knew we could do better. So we took Move and Get Comfy. We did the refresher. So we saw Jeanette again, and we, of course, had our same wonderful doula. I also did a one-on-one session with Jeanette just to address some of the specifics of my second birth that I had concerns about or questions or things that I thought could be better. And that was actually when she talked to me about the possibility of stopping the pit or turning it down, which I actually now ask our L&D nurses to do sometimes when I go to place an epidural and the woman is having contractions like back to back to back. I just say, can you turn the pit off to like put the epidural in? And perfectly reasonable to do. Not going to hurt mom or baby.
Yeah, we can always restart it. It's a not a problem at all.
So that was how we prepared for that one. Pregnancy was going great as usual. I seem to have great pregnancies. Luckily, I'm very lucky. I did end up being induced. I was pretty unhappy about it, but it appeared that the baby was measuring small. I didn't think it was, but my obstetrician did. So we went with induction. This induction went very smoothly and quickly, so much better than the last. I will say I was with my obstetrician for this induction, so it was someone I knew he knew what I wanted, and I trusted him in general. So I think that helped it go more smoothly. I was on Pitocin for a little bit, but actually once I went into active labor, I was off the Pitocin. My body, I think, was pretty close to going into labor, so I didn't have to stay on it. I actually got into the shower. I wasn't hooked up to an IV. I wasn't hooked up to any machines. We did intermittent monitoring. Stayed in the shower till it was apparent that probably it was going to be time to push pretty soon. And I very easily pushed out a baby in the position I felt comfortable in. I moved around freely, and it was the most amazing experience of my life.
Yay.
Oh, I'm so happy. And so the other two birth experiences, yeah, you know, and usually it's the opposite. Usually people have, we call it the third baby wild card, but your wild card was the good one. And I love to hear that. So you had the same obstetrician for your prenatal care, it sounds like, for all three of those births. But as we've discussed before, you know, there's very few providers nowadays that can be on call 24/7, 365 for their own patients unless they're, you know, in home birth midwife, right? So, so it looks like you lucked out with having the OB that you had hired and trusted to be the one instead of an on-call doctor with your third. So that's an exciting, lucky moment. And so the fourth, I'm assuming that you were thinking, okay, we finally figured out the right formula here. We're gonna we're gonna try this one more time and have the fourth baby. So what happened with that?
Yeah, so more reading. I did see a chiropractor for the third pregnancy and of course for the fourth pregnancy. So we saw a chiropractor throughout. We felt well prepared. We had our doula again, so we overall felt like, you know, we know what can happen, but we feel like we prepared pretty well for most of those things. We did consider a home birth actually for the fourth one, but the anesthesiologist and me couldn't get past the risk of uterine rupture after cesarean, and I just mentally knew that I probably wasn't going to be able to do the home birth as much as I emotionally wanted it. I knew that mentally I probably couldn't do it. So we ended up sticking with birth in the hospital, thinking that, okay, we've got our support people, we can do this. Induction was offered several times. I declined, put it off, and I knew I just needed a little more time. Our babies aren't 40-week babies, is what we decided. So a little before 41 weeks.
Your oven cooks things a little bit longer.
Yeah, it's just the way our babies are, and I know that. So a little before 40 weeks, I could tell that my body was gearing up. I was like, okay, this is good. Things are starting to happen. This is going to happen relatively soon. I could tell. And sure enough, at 41 weeks, I went into labor. I labored at home. It was wonderful. It's so nice to be at home and not in a hospital. It was great. I had Mike with me, so it was wonderful to labor at home. I really felt good. It was very manageable. Once we decided it was time to head to the hospital, got in the car, head to the hospital, everything's going well. Got there and I was clearly in active labor, so you know things are moving quickly, IV, labs, that sort of thing. Once I was all done, I wanted to get into the shower, and because that had really helped me in the past. That's kind of when things started to not be so good. The on-call obstetrician was very rude, very unprofessional, and very condescending. She didn't know that I was a doctor. I don't know if that would have changed anything, but regardless, it was not appropriate behavior. So it was very challenging to manage the tension and the bad dynamic between the labor team and us and manage labor. So eventually, once I was a little over 9 centimeters, she said that she could push the rest of the cervix back with the next contraction. I elected to do that because I was just exhausted from labor and managing this sort of bad vibe in the room. So I did that, and then right after that, I was pushed onto my back. The obstetrician said, pull her down the bed, grab her feet, which was done, and I was physically restrained in a very uncomfortable, painful position while the obstetrician basically yanked our baby out of me. And
oh my gosh.
They wouldn't listen to me or my husband. They would not stop. They wouldn't let go of me. And our baby was born. She was fine. She was on my belly after she was born, but it was awful. It was truly awful.
And you were saying,
and so what types
that
of things
hurts, you know,
oh yeah,
right?
that's what I was gonna
And I remember hearing your story that, like, what was your doula doing? What were you saying? What was your husband doing? Like, what was the dynamic during this time where they were doing these things to you? And the nurse, too.
Right. So our doula was off to the side. She was largely observing at that point because, quite honestly, there wasn't anything she could do. So she was observing, which was helpful to talk to her afterwards about what her observations were. My husband and I kept saying, I can't push like this, and that it hurt the way they were putting my legs. My husband kept saying she pushed better on her side, and he kept saying that. They would not let go of me, would not let me move at all. And they had asked me, what position do you think you will push? And I said, probably hands or knees or my side. That seems to work best for me. But when it came time for it, it was, standard dorsal lithotomy. This is what we do. This is how we do it here. We're going to hold your legs. We're not going to let go of you, regardless of what you say. And, in someone who has an epidural, they may not feel everything that's being done to them, but when you don't have an epidural, you can feel everything. And so it was extraordinarily painful as well compared to, I mean, when I pushed our third baby out, I didn't have pain per se, but this was extremely painful what they did to me.
But also the pain you were feeling was in your hips, right? If I remember correctly.
A lot of hip pain because unfortunately, Melissa, you can probably speak to this better. I've seen and experienced that sometimes they are overly aggressive with pushing the legs back towards the mom to the point where
Yes.
my knees were about where my ears were, which does not, my body does not do that. So I was basically trying to birth my baby straight up to the ceiling. Mike said he could see the baby kind of try to come up and then rock back down because I was literally birthing straight up. And Melissa, you could probably speak
Yeah,
to that.
in fact, that when a birth giver has an epidural, like you mentioned, they often don't feel that the care providers, whether it's the the obstetrician or the midwife or the labor nurse, if they're hyper, like pushing your knees towards your ears like that, it can actually cause temporary nerve damage in your hips. And I have seen in my 14 years as a labor and delivery nurse, I have seen a handful of women have to walk with a walker after birth for several days or weeks and need a PT consult because of somebody putting too much pressure on their feet and cranking their, knees back towards their ears for any amount of time during pushing, especially if it was a long push. And like you said, if you have an epidural, you might not be able to feel that they're, moving your body in a way that it doesn't want to move, right? If someone was trying to, twist my arm, right, and bend my elbow the wrong way, I could say, ow, stop, right? But if my entire shoulder and arm was numb, I wouldn't be able to feel if they were trying to bend my elbow the wrong way. And that's essentially what happens a lot. People who have epidurals, also, one of the risks that's not often talked about is that your care providers can be more aggressive with your vaginal area. And they often are without you noticing because you can't feel it. And so what's most disturbing, though, is that, I have seen care providers that are used to being very aggressive with women's vaginas and perineums and doing very aggressive perineal massage to epiduralize patients that then have the, occasional natural childbirth patient that comes in and that person will scream at them, ow, stop. And then they like recoil back and stop. They don't realize how rough they were being. What's most disturbing is that you were telling them how much it hurt and they did not stop.
And just to highlight, you did not have an
is,
epidural for this situation. You could feel
No.
everything that
right.
was happening.
And you had two
And there was no
vaginal
explanation. The
deliveries
heart rate
before,
wasn't
too.
down. You didn't have a high blood pressure issue. There was no explanation of why they grabbed you and put you on your back and did that with your legs, correct?
Correct. Yeah. And I mean, I can hear a baby's heart rate, so can Mike, and so can our doula. And we've heard what a low baby's heart rate sounds like. It was clearly not the situation. So yeah, I was screaming because, as similar as it, they were being very aggressive with yanking her out. I actually ended up with severe pain right at the pubic bones because I think there was slight dislocation. So when I was trying to walk the next day, I had sharp shooting pain in that area, which after our third baby, I actually packed our stuff up and moved us to our postpartum room because I felt great, like ready to go. And then with this baby,
you're an athlete. Like you can do like 10 and 20-mile bike rides. Like that's a typical thing for you. So it wasn't like you're not fit.
Yeah. So I mean, and that was the other thing. I mean, I was after the fact they said, there wasn't time for me to get on my side or anything. I could move around just fine. I worked up until a couple of days before our baby was born, so I could move around just fine. So, what they were saying after the fact really wasn't true. So yeah, I think, it was very traumatic in the sense that they weren't listening to us. They were physically restrained. I mean, the physical restraint was very distressing, and the pain, and then not listening to us.
And what was the nurse doing at this point?
I mean, it's a, yeah.
She is the one who pushed me onto my back, and then she grabbed onto my legs.
Your assessment is absolutely correct. Yeah. No, continue. Sorry.
She actually, it turns out, was a very new nurse, and I think may have been getting a little bit of pressure from the obstetrician, which I think played into what happened. But, again, I don't know exactly what the dynamic was there because I wasn't necessarily focusing on that.
Well, I don't think you're going to name the doctor during this show, but I know who you're talking about. And the reputation is just very interventive. I've heard that, this doctor could be, if you explain what you want, sometimes then you could get what you want, but left unsaid. But you said what you wanted, you knew what you wanted. And in this moment, you're being hurt physically and you're not being listened to. And there's just no excuse for that in any part of life, you
Right.
know?
It's retaliatory. I mean, it's
Mhm.
retaliatory behavior. Obviously, you not wanting to go with the flow of the way that they always do things left a thorn in somebody's side, and you were retaliated against. I have seen that dozens and dozens and dozens and dozens of times as a labor and delivery nurse with a variety of providers. So
Yeah.
after your birth trauma, what did you do to heal physically and emotionally for that?
So the first thing was I reached out to people who I trusted. So I actually reached out to Jeanette. I reached out to my sister, the people who I knew would empathize, wouldn't just tell me like it didn't sound that bad. People who I really trusted. So I do think reaching out to people is good, but I think being selective about who you reach out to because you are in a very vulnerable state at that point. So I did reach out for help. I also specifically asked Jeanette if she knew any therapists, and she did. So that was tremendously helpful. I definitely needed therapy. Um, I knew fairly soon after we got home that I was going to need therapy because I found that I was having trouble sleeping. I was having those flashbacks. Even Mike was actually, he was having trouble sleeping, and the last thing you need when you bring a baby home is you wake up to change the baby's diaper in the middle of the night and feed them, and now you can't go back to sleep because you're having flashbacks. So we knew very quickly that we needed help.
That's a very good
Yeah.
point. Oftentimes, the partner is experiencing PTSD symptoms or traumatic response from vicarious trauma, from witnessing someone that they love and care about be traumatized and abused.
Yeah.
Yeah, absolutely. And so as to inter to have a little intermission before we get onto more details about your experience, but as, a doctor yourself, you did decide to file a complaint, but before you even had kids, like what was your general knowledge? What was the vibe in your profession, in your education, and then when you were working about patients filing complaints or even staff members like a nurse, for example, filing complaints against other providers? So like given your medical background and now you're a patient who wants to file a complaint, sort of what was your background in like how to do that, when to do that, what's the vibe about doing that?
So I knew that you could report physicians to the Board of Registration in Medicine. That I was very much aware of. And I know that you can report an incident to the Department of Public Health. So those are the two things I was most aware of. Um, I knew a little bit about patient advocacy, and I did end up reporting it to patient advocacy at this hospital. From the DPH website, I found that you can also report a nurse. So that's an option if it's a nurse versus a physician who you're reporting. And then another option, the Joint Commission of Accreditation for Hospitals is another option for reporting. But those were the entities I was mostly aware of. As far as reporting within the hospital, a colleague or witnessing something, I know that it happens from time to time. I don't know how often because it typically goes to a department chair. So I don't know how often that really does happen.
And was there an attitude that you had learned before that of like, oh, you shouldn't do that, or oh gosh, a patient complained about us again? Or do you know, like as a physician, that this other physician had a report filed? Like, are there rumors about that? Like, what do you know, like as a professional working with
Um,
other professionals about that?
I don't know a lot of physicians who have had complaints filed against them. I've seen practices that I thought should be reported, but I don't know that they actually get reported that often, to be honest.
And there's no talk amongst the department, like I, as a I remember back in the old days before I had asked questions and learned more, you think, oh, well, there's a department chair, and then there's like the CEO of the hospital, and then there's the director, the medical director, and then there's a hierarchy there. And so,
Right.
as an outsider, human person living in society, you think, oh, well, there are people that you'd report that to, and those people might get in trouble. And then eventually they might get fired. And I remember, Melissa, you telling me a story about a doctor that you used to work with who had done some horrific things to some babies, actually. And that doctor, I think, was asked to resign and then moved on to some other hospital where they're continuing to do the same thing, right?
Yeah, so I worked with a physician that was medically incompetent, negligent, was um, outrageously verbally abusive to patients and to nurses. This physician also had been responsible for some sentinel events, which in the world of healthcare is considered, quote, a never event. These are things that should never happen. For example, this wasn't one of them, but like doing surgery on the wrong body part, right? We know that those things have happened. Those are considered, there should be so many safety guidelines in place that that's something that should never happen. And this particular provider had sentinel events that they were responsible for. And what the nurses were doing were filing what we called like incident reports, which, as you've already described, would go to the nurse manager and to the chief of obstetrics. But that's where they would stop. And then the chief of obstetrics would pull that provider aside and say, you really can't do that anymore. And then nothing would happen. That doctor would be right back on the floor the very next minute. And it
And
turned
that's
out
the
that
stuff that people in
eventually,
society don't know. They think, oh, well,
right,
if they get in
eventually,
trouble with their chief, they'll be told to stop doing that, and they'll have to stop doing it, like a boss would tell an employee, and the employee would go, oh, if I do that again, I'll get fired. But that's not how it happens.
oh yeah, no, it was basically like a slap on the wrist, and it was business as usual. There wasn't. You would think that if you got spoken to about the way that you're speaking to patients and nurses, that maybe you'd tone it down a little bit, at least for a couple of days. But it would be like right back to the way it was the second that
Mm.
doctor walked out of the office. What ended up happening was this doctor's contract ended up just expiring and was not renewed. And that doctor was then given a recommendation for her next job and then moved to a different hospital in our community and is practicing as an obstetrician at another hospital. And only after that doctor left did I find out from a nurse who worked at another hospital that that doctor had come to our hospital after their contract wasn't renewed at another
Mm.
hospital. So it's really just, because of contracts and I'm sure some type of unspoken code of brotherhood, sisterhood. I don't know that, if you don't make waves for us, then we will just part ways and pretend it never happened. And so, yeah, nothing ever happened to that provider, despite the egregious things that this provider had committed against nurses and babies
Yeah.
and birth givers. So it's pretty upsetting when you learn that.
Yeah, I can speak to that a little bit. I can say that to get rid of a physician, I don't know about nurses specifically, but I know that to get rid of a physician is very difficult. It requires a lot of documentation and being very diligent to support your case. And then they can come back and try to sue you and say that you don't have a valid case. So there's that issue. So it is very difficult. As far as letting a contract expire, you can certainly do that and not renew it. Usually when it comes to referrals, because of course they will be asked for referrals from people who you've worked with, you have to be very careful what you say in a referral because, again, they can come back to you and sue you. Now, most of us can read in between the lines when we hear a not glowing referral and say there's some red flags in what's not being said here. But these people do manage to get jobs. I think a lot of times it's at a place that's really in need of a body, and
Yes.
they may choose to ignore the red flags and what's not being said. But for anyone who's being really selective about who they hire, typically you can tell when a verbal referral is not really positive. But yeah, it's sad because these people do eventually find a place to work.
And there's no way for the public to figure that out.
No, no way at all.
So, and I know from talking to families too that, you can go and you can ask, oh, well, oh, my friend likes this doctor. But what's so fascinating, I can think of a few different providers over the years that I knew they were just not that nice, and they were very quick about visits, and they didn't give people the time of day, and they weren't that respectful of people's wishes. But because it's my impression over the years is that because many parents don't know the difference, they don't know what it is like to have a care provider who isn't rude or isn't mean or isn't quick or isn't dismissive, they just think that's normal because that's how that we were raised culturally, and maybe that's the only type of doctor you've seen, or you've seen this one for 20 years because they were your GYN provider, and now they're going to be your doctor, and you're like, well, they're nice enough, and then you recommend them to their friends because that's the only one you know, and you like them, so you hope that by continuing to see them, it like validates your choice that like someone else might choose them too. So we don't even know sometimes that we're with a provider that's awful and that they're going to treat them awfully, or maybe your vibe is different with that person. I've seen people where, like, I remember one doctor in particular that I had two really good experiences with her as a birth doula. And I thought, like, the way she spoke to my clients was lovely and she was so encouraging. And then I was speaking to some other doulas and they're like, really? Well, that's not my experience with her. And that was so interesting. I was like, I had two experiences over hours and hours and hours where I was constantly impressed by this doctor. And then other people had different experiences on different days, It's just, you just never, it's hard to know. So it's really talking to labor and delivery nurses and birth doulas, I think, that are the key to figure out who really are the tried and true care providers who are consistent in their good treatment of people, right? It's one way of doing it. But again, even in your situation, Rebecca, like you had one of, a well-known doctor as your OB who's very well known to spend a lot of time and be very lovely and sweet and respectful, and he wasn't there that day. Yeah, because you don't get the people that you sign up for most of the time.
Mhm.
Yeah.
So what happened with your complaint? How did it start?
Yeah.
So Jeanette also connected me to Kristen, who
Kristen Pascucci, right?
Yeah.
Of
So
Birth Monopoly.
Yeah, Birth Monopoly, and she helped me draft a letter that I sent to the Department of Public Health. I also sent a letter to the hospital detailing what had happened because patient advocacy, although they said they were going to follow up with me, never followed up with me at all. They completely dropped the ball, which actually was pretty irritating, which made me all the more interested in writing to them. From the Department of Public Health website, I saw that there was a place to report the nurse. So I actually reported my nurse. The reason I reported my nurse was once I did request my medical records because I wanted to make sure that I hadn't missed anything. And I spoke to my doula about the experience to make sure I hadn't missed anything. And I looked through my records and I noticed that the nurse had actually written something that was completely false, that was sort of covering herself type thing. And so I actually reported it for fraudulent documentation in the medical record. That was what I reported her for. I reported the obstetrician, of course, for what was done physically, the assault. And I reported the hospital to the Department of Public Health as an incident report. So once you send those letters, the Department of Public Health is obligated to investigate. So they actually do speak to the people. They make a site visit to assess whether or not there was anything that needs to be remediated or to figure out if there was anything that was not within standard of care. So that does take some time, but they did do that. The hospital did write back to me, although it took them a long time to get back to me. It was the communications between me and the hospital were very delayed on their end. And then the Board of Registration in Medicine, once they get your complaint, they typically contact the person who makes the complaint to get any additional information that they need. And then they send the complaint letter to the physician, and the physician has a period of time to write a response letter. Once that response letter is sent to the Board of Registration in Medicine, and the board reviews the letters to decide if any disciplinary action needs to be taken. And then the person who made the complaint receives the letter of the result of their deliberation. So that was.
So how long did that take from?
That took a year for me.
How long did it take from filing?
A year.
A year.
A year.
And when did you start it? Like how many months or weeks postpartum were you when you started the complaint process?
I started working on writing things down I wrote my story for myself within the first 2 weeks because I wanted all the details to be very clear and fresh on paper because I knew I was going to do something. I didn't know what at that point, but I knew I was going to do something because I could not imagine letting this go without addressing it and letting this happen to other women. It just was so wrong in my mind. And I think that was the thing. Being in medicine in the particular field I'm in, I knew it was wrong. And I know that some people wouldn't necessarily know that what was done was wrong, but I knew that it was absolutely 100% wrong, and I couldn't not address it. I just couldn't, because then it means it's going to happen to other people. So I wrote it all down. Then when I got, then I did get into therapy, and also we were kind of busy with, our baby was having feeding issues, so we got a little tied up with addressing the feeding issues. Once we kind of got things settled and I was doing a little better from an emotional standpoint, then I started really working on actually composing a letter to send, and that's when I worked with Kristen. So that took quite a few months because I wanted to send all the letters out together. So I was writing basically 4 different letters. So I got the 4 different letters out, I think, about 5 or 6 months after her birth. Those letters all went out together, and then, like I said, the hospital was a little delayed in their response, but we were going back and forth. The Department of Public Health gave me their final sort of assessment of the situation about 6 months after I submitted the letter, and then the Board of Registration, it was about a year after I submitted the letter.
Wow. Oh my gosh. And then what happened? What did the doctor say? What was her response?
Oh, yeah. So that's the other thing I forgot to mention. You do get a copy of the doctor's letter, which I actually found very helpful, even though no disciplinary action was taken, which I wasn't surprised by, because I think a lot of the people who work in these institutions also think that that sort of thing is normal. So I wasn't surprised, but I did get to read the whole letter that she wrote, which was very insightful, and it confirmed for me that her attitudes match her actions. She believes that the obstetrician tells you what to do, and you do it, and she should be in control and in charge. And that was very clear to me during the process that she clearly wanted to be in charge, and there was a power struggle there. And she was going to, as Melissa said, it was retaliatory. And so the letter clearly illustrated that. I mean, it also, some of the details that she wrote were actually completely false. But, for instance, one phrase in the letter was, there was nothing traumatic about the birth, but trauma is defined by the person who experiences, not the person who inflicts it. So many statements throughout the letter that clearly indicated that these are her attitudes. And as you're saying, does any of this change behavior? Maybe, maybe not. For some, it might. I think what it does do is it makes people a little more aware of the possibility that they could get reported again for similar behavior. It might make them be more selective about who they treat in what way. But I still think it's worth reporting because I think the first step to raising awareness is reporting. Is just the more people who report it, the more it becomes clear that this is not a every so often issue. This is regularly occurring. So that was the reason I still chose to report, even though I knew probably not a lot would come of it that I could see. I'm sure there were meetings and things that happened in the hospital, but that is one thing I think when you report, one thing you have to be prepared for, that you may not, it may not be exactly the resolution you're looking for or hoping for. There may be a lot of stuff that happens behind the scenes that may change some people's practices.
I would agree with that. As a nurse that's worked in the inpatient setting, I know that, even small complaints from Press Ganey surveys, which are this,
Mm.
national organization that basically does these sends out patient surveys in the mail that people fill out about their nurse and their doctor and their
And they
cafeteria
really should
food
fill
and
them
the noise
out.
in the
Fill them
hospital and
out,
everything,
people.
right? They really, really should fill them out because reimbursements are linked to them, and a lot of other things that hospitals care very much about. So they very much care about Press Ganey scores. And so even something like, you know, the nurse didn't empty my trash and I want her to, like, we're going to get an email about that. Now that might not be a very big deal, but so when it is a big deal, when somebody really takes the time to write an actual complaint, even if it's just to the patient relations department of the hospital, or finding out the nurse manager's email and sending it directly to the nurse manager, there will be a staff meeting about it. And even if the perpetrator doesn't ever change their mind, what I will say is it definitely helps to support the people in the institution that know that this is wrong and don't want it to happen either. Because there's a phenomenon that I know I've experienced. I don't know about you, Rebecca, but especially when I was a newer nurse, kind of like, something's wrong and it hurts in your body, like it hurts in your stomach, like it makes you sick to your stomach, but everybody else around you is acting like it's totally normal. And so then you start to like second guess yourself, like, is this really what I think is happening? And am I having this a response that's unusual, or why am I the only one that thinks this is wrong? Because it's like the power of of numbers, right? Like if everybody in the room, nobody's saying
Peer
anything,
pressure.
then it just exactly, right? So I think that writing those complaints, like you said, if somebody's going into writing these complaints expecting a lawsuit and damages and the doctor being stripped of their medical license, that's probably not what's going to happen. But that doesn't mean that it won't make some of a ripple, small ripple, big ripple. But it takes a chance. It takes people taking chances like that. So I'm very impressed. It's hard enough to like put real clothes
Mm-hmm.
on after having a
Yeah.
baby than like drafting 4 well-written like
When with
emails
four
and
children
letters to
in your house,
people.
including a baby, you know?
Exactly. 4 children in your house, feeding problems, breastfeeding, sleep deprivation, PTSD flashbacks. The fact that you did that, I think is remarkable. I also liked your advice about writing it down, even if it's just typing it in an email to yourself on your cell phone one night, like that you don't proofread and has tons of spelling errors, just like writing it down as soon as possible and then figuring out what to do with it later. I think it's great
Yeah.
advice.
Yeah. Well, thank you for doing it on behalf of everybody else. We hope that that's practice has changed with not only that doctor but others as well, and maybe that, I mean, I'm sure the nurse is aware of that filing that complaint and that she's going to be a little more careful. Was there ever a time that the nurse, like, are they allowed to reach out to you or respond to that complaint at all? Do you ever see what like she had to say for herself?
Not that I'm aware of. I didn't get any written information that she had given to the board of nursing. So I think perhaps for nurses it may be a slightly different process just because it's a different institution as opposed to the board of registration in medicine. So I'm not sure. I
And you
suspect.
didn't get a basket of snacks and flowers from the doctor apologizing either.
Oh no, I got that lovely letter that made it clear that she still thought that she needed to be in control and in charge. And that
I
was a year
I
after.
remember,
So
I don't remember the exact quote, so correct me because I'm sure you read the letter more than I have. But there was something in there about like, I'm sorry that Miss Zanconato did not get the experience she was hoping for. Wasn't it something like that?
right, she clearly had an idea of how she wanted her birth to go, but that it maybe didn't take into consideration the safety of her baby. So it's some pretty
Well, yeah, that's
nerdy
very
words.
telling.
Yeah, it was. It was the whole letter was quite enlightening. So now that COVID's a little more in control, I hope to actually do more with that letter because I think that letter in itself can really illustrate some of the serious systemic problems in in obstetrics, because I think it is the attitude, demonstrates the attitudes that a lot of obstetricians have.
Right. Assuming and treating pregnancy and labor and birth as pathological situations that need to be actively managed. I mean, the fact that what you were asking for was evidence-based practice that is in the best benefit, that provides the best benefit of oxygen and positioning to your baby. She's being, saying that making you do the opposite was what was right, and you wanting, laying flat on your back in dorsal lithotomy with your legs pulled back, that is, though it compresses the vena cava and decreases oxygen to the baby, she's saying, what Rebecca wanted wasn't in the best interest of the safety of her baby. I'm sorry she didn't get, the puppy dogs and rainbows birth experience that she wanted, but I had to take action to, make sure that baby was safe. I mean, that's what that says to me. And it's just hilarious because, there are so many practices in obstetrics that still persist to this day that are outdated, that are not evidence-based, that are harmful, that cause morbidity for babies and birth givers. And, the attitude is, this is the way we've always done it, so this is the way it has to be done. It's really
But so
unfortunate.
much for informed consent.
Well, that's the other piece of it, that many providers don't treat obstetric patients as if they are patients who have rights to consent or decline. That you walk in the door and you're birthing a baby, and you have lost your rights as a patient. There's no other area in medicine that I can think of where you can just say, we're going to do this to you because we've decided this is what we want to do, what we need to do. You don't get a say. So it really does violate your patient rights. I can't just drag a patient to surgery and give them anesthesia against their will, regardless of whether or not I think it's in their best interest or the surgeon thinks that they have the right to decline. And as obstetric patients, you don't lose those rights just because you're having a baby, but a lot of people think you do, medical professionals and lay people.
Absolutely.
And you were saying before we started recording that you had actually recently experienced a situation. So now in your job, because you're now doing obstetrics, you observed something and you were in the room. So you were sort of on the other side of it as an observer. Is there anything you can talk about related to that?
Yes. So number one, having learned more about birth trauma and obstetric violence, I knew this was not okay. So I was aware of it. I don't know if I would have been as aware without having experienced this and looked more into what is obstetric violence and what does it really encompass. So I observed it. I didn't say anything at the time because I was concerned that it was clearly the dynamic between the nurse and the patient was bad already. I could tell just from the phone conversation when I got the call to come upstairs. I knew that, okay, there's something not good going on here between the nurse and the patient. So I didn't say anything at the time because I was actually afraid the nurse might take it out on the patient if I said something in front of the patient. I was also just shocked, and I was in the process of setting up for an epidural when I saw it happen, and it was sort of happened as I'm trying to do things here. So after the fact, I did report it to the obstetrician. I also asked her if she had received a complaint for the patient. That went up to the chief of obstetrics, and then I reported it to that nurse's supervisor for her to look into it. And I will say it was also a very triggering event for me. After experiencing trauma, when you see something like that, there are definitely times where I get triggered, and I have to sort of be prepared for that and manage it. But again, I can't not report these things after what I've experienced and what I realize is happening in many places. I can't stay silent and let things like that happen. Every time it's reported or addressed, I think it's one step closer to improving things for many people.
Absolutely.
Thank you for doing that. It's a hard role to play, to be the whistleblower, but it's an important role to have. Do you have any last advice for somebody who's about to embark on a birth experience, as far as, as we've discussed, and I think at the end of the day, you can try to stack the cards in your favor as much as possible. And if someone is intent on committing abuse towards somebody, that's not something that your partner or doula or even the anesthesiologist in the room can say something about. You know, I've experienced that as a nurse. I've been in your shoes before, Rebecca, where saying something in front of an obstetrician that I feel is being violent and abusive, I feel could be retaliated against the patient after my shift is over, after I leave the room. So I understand that very, very deeply. But do you have any last pieces of advice for somebody that, you know, has to birth in this broken system?
So if you are choosing to birth in the hospital system, and that's certainly a big choice too, because there are other options. But if you do choose to birth in this system, I think getting a really good childbirth class. Of course, Jeanette's classes are excellent. So anyone who has access to those are great classes. If you don't have access to those, finding
Melissa teaches with me now too, so she's
yeah.
yeah.
Yeah, so finding really high quality childbirth classes to prepare and reading and becoming informed. And then finding the right support people. So a doula, I think, is an excellent idea. It really, you know, again, they can't stop someone from physically harming you, but they can really advocate for you when you're in that place where it's not that you can't advocate for yourself at all, but you're also managing labor. And a significant other, as much as they may want to advocate for you, they are very emotionally involved too. So my husband certainly was trying to advocate for me, but he's not in a place either to really, you know, stop what was happening. And he doesn't have the same knowledge of pregnancy and birth that a doula would have. So I think having a support person, whoever you choose, plus a doula really is very valuable. And then, yeah, just being as informed as you can and asking questions. So knowing that you have the right to get the information you want to make an informed decision, and knowing that you have the right to say no.
Right, I think that's key too, is that speaking up in that moment or right after it happens, or, you know, in that moment is so key too, so that at least later you can say, I said something. I said no, I said stop. And fortunately, one word responses can be enough to, maybe it'll stop it, but even if it doesn't, you made your choice known. So if you do decide to file a report, then you can say, I told them to stop. Or even if you didn't, at least that person who's perpetrating that against you is hearing you say, ooh, she didn't like that, which is key. But yeah, I think one other thing I would add is really talking with doulas in particular. Even if you don't hire them, doulas are lovely in that they're willing to talk to you. And so you can say, well, I mean, they don't want to badmouth a specific care provider either, right? But we can read, you know, you can read between the lines like, oh, well, have you had many clients who choose to work with this doctor? Do you have an experience with this midwife?
Or this hospital or
this
this
hospital?
whatever.
Like, what is your favorite practice to join? Or, you know, there's ways to word it so that they don't have to say they wouldn't. For example, the more experienced I got as a doula, I learned that there was one particular practice at a hospital I used to go to a lot that I and many other doulas had just had horrible experiences, meaning that our clients had had horrible experiences with those care providers. And so I remember someone called me, and I got to a point where I would say, well, I don't attend births for patients of that practice anymore. And they'd be like, oh, why not? Well, I don't find that they respect the choices of my clients as much as other practices. You know, like there's ways to word it. And I had colleagues, other doula colleagues at the time, that we would talk about this, and they'd go, "Oh, I just say I wasn't available for their due date if they were with that practice." I'm like, "That's not nice. Like, you're not helping that person at all. When that's literally not the reason. You're literally lying to them. You're available for their due date. You just don't want to go to their birth with that care provider. So instead, say I don't go to births with that practice anymore because I don't find that they treat my clients with respect." And so you're not saying a certain person's name, but I think that's also helpful. So many people say to me like, oh, well, I'm going to have my mom there. I'm like, that's not the same thing as a doula. I would love for your mother to be there. And even if she's got 6 kids, she's experienced in birth, and that's lovely and supportive, but she doesn't have the experience in a hospital setting of navigating that and helping you advocate. And sometimes I think there are things that nurses who are awesome, like Melissa, I always say like the nurse who loves natural childbirth, even if you want an epidural, like she and doulas, we know ways too that even beforehand we think we're preempting something bad from happening, you know? So,
Definitely.
we can never be sure that we did, but we think we're saying or doing or encouraging you to do something in a certain way that helps possibly prevent a bad thing from happening.
I'll also give the listeners a tip. Whenever you hear a labor and delivery nurse, if you ask one, oh, what do you think of Dr. So-and-so? And if their answer is, and I quote, they're an excellent surgeon.
Yes.
That is code word. That is
Or
code.
stay away from
That
them.
is labor and delivery code for, unless you want a cesarean or a hysterectomy, don't go to that provider for a, regular pregnancy, healthy labor and birth. That is a definite.
Yes.
It's like the Jeep wave. If you drive a Jeep and everybody knows about the wave, that's the Jeep wave of the labor and delivery nurse.
Yes, the Jeep wave. I know what that is. Awesome. Well, thank you.
So thank you so much, Rebecca.
Thank you, Melissa.
And if anyone's learning, yes, thank you for coming on the show. If anyone's interested in learning more about birth trauma and how to heal from it, consider visiting the Birth and Trauma Support Center online for a directory of trauma-informed care providers and mental health professionals that can help you start on a journey towards healing. And our next episode will be a little bit later. We try not to line up heavy topics in a row. So our next episode is going to be all about infant massage and how it can help with feeding and digestion in babies. So that'll be an interesting episode. Looking forward to it.
Awesome. Coming from someone who's not local too. So awesome. So we hope you'll visit babiesincommon.com/show to view all our previous episodes and see what we have coming up. Our show is available as a video recording and a podcast on our website, on Spotify and Apple Podcasts. And of course, if you enjoy this show, we'd really appreciate you writing a positive review on social media or the sites where you get your podcasts. Visit our website or Facebook page to learn more about the groups, classes, resources, consultations that we provide. And we certainly hope that'll help you rock your birth and thrive as a new parent. And always remember that Babies in Common is a community for you. After all, we all have babies in common.
Thank you, Rebecca.
Thank